A 72-year-old woman named Patricia came to me 18 months ago. She was the kind of person who read every label. She took her health seriously. She exercised 3 times a week. She cooked at home. She'd been taking a daily vitamin supplement for 11 years, something she had started after reading that most older adults were deficient. She was proud of it. She mentioned it to her doctor once, and her doctor nodded and said nothing. And further, when Patricia came to me, she was not there for the vitamin. She was there because her calcium levels kept coming back elevated on routine blood work. Her doctor had flagged it twice. She had developed kidney stones for the first time in her life at 70. She had been experiencing unexplained nausea, constipation, and a persistent low-grade headache that she had been managing with over-the-counter pain relief for months. Her cardiologist had noted some concerning calcification in her coronary arteries that had not been present 5 years earlier. Nobody had connected any of it to the supplement she had been taking every single day for 11 years. Nobody had asked what was in it. I'm Dr. Kevin Adewale. I'm a cardiothoracic surgeon. I've spent over 30 years operating on hearts, repairing arteries, and watching what happens when well-intentioned health decisions go quietly wrong over years and decades. What I'm about to share with you, most doctors won't bring up at your annual checkup, but after 60, it matters more than you think. Today, I am going to talk about one specific vitamin A, vitamin that millions of adults over 60 are taking right now in doses that are silently damaging their kidneys, calcifying their arteries, disrupting their heart rhythm, and accelerating the very decline they are trying to prevent. I am going to tell you what that vitamin is, why the problem is so much more common than people realize, exactly what it is doing inside the body, and what to do instead. Stay with me. Before I name the vitamin, I need you to understand something that most people have never been told about supplements and the aging body. After 60, your body does not process vitamins and minerals the way it did at 40. The kidneys are less efficient at excreting excess. The gut absorbs some nutrients more readily, the liver processes others more slowly, and the regulatory systems that once kept everything in balance require less input. To tip into excess, a dose that was appropriate for a 4 or 5-year-old can become genuinely toxic for a 70-year-old taking it for years without monitoring. Think of it this way. Imagine a reservoir with a carefully calibrated overflow valve. When the reservoir is young and the valve is working perfectly, you can add water generously and the excess will drain safely. But as the valve ages and becomes less reliable, adding the same volume of water begins to back up. The reservoir fills past its safe level, and the pressure that builds does not announce itself with an alarm. It seeps quietly into the surrounding ground, into the foundations, and by the time the damage is visible, it has been happening for a long time. Supplement use in adults over 60 in the United States has increased by over 80% in the past 2 decades. 80%. The supplement industry is now worth over $50 billion annually in the US alone, and the vast majority of that growth has happened without corresponding medical supervision, without regular blood level monitoring, and without any systematic education about the very real risks of taking too much of something the body cannot efficiently excrete. The assumption driving most of it is simple: more is better, natural is safe. If some is good, more cannot hurt. That assumption is wrong. And the vitamin I am about to discuss is the single clearest example of why. Let me show you exactly what I mean. The vitamin is vitamin D, and before you switch off, before you think you have heard this before, stay with me, because what most people know about vitamin D toxicity is a fraction of what is actually happening, and the damage it causes is specific, serious, and in many cases completely invisible, until it has already progressed significantly. Here is why this surprises people every time. Vitamin D has been one of the most aggressively promoted supplements of the past 20 years. Deficiency in vitamin D is real, documented, and genuinely common, particularly in adults over 60 living. In northern climates who spend limited time outdoors, the health benefits of correcting a genuine deficiency are real. Bone density improves, immune function improves, mood can improve. The research on deficiency correction is legitimate and worth taking seriously. That is not the problem. The problem is what happens when people who may not be deficient, or who correct their deficiency and then keep taking the same high dose indefinitely, accumulate vitamin D2 levels the body cannot safely manage. But here is what most people are never told. Vitamin D is not water-soluble. It is fat-soluble. That is not a minor distinction. Water-soluble vitamins, vitamin C, the B vitamins, dissolve in water. Your body takes what it needs and excretes the rest in urine. Excess is eliminated efficiently. Fat-soluble vitamins, vitamins A, D, E, and K, dissolve in fat. They are stored in fat tissue and in the liver. They do not exit the body in urine. They accumulate. And vitamin D in particular accumulates in ways that can take months to resolve even after supplementation is stopped entirely. Here is what is actually happening inside your body. Vitamin D's primary job in the body is to regulate calcium absorption in the gut. When vitamin D levels are adequate, the gut absorbs roughly 30 to 40% of the calcium in your food. When vitamin D levels are significantly elevated, a condition called hypervitaminosis D, that absorption rate rises dramatically. The gut becomes hyper-efficient at pulling calcium from everything you eat. Calcium that would normally pass through now enters the bloodstream, and blood calcium rises to levels the body was not designed to sustain. Elevated blood calcium. That is the mechanism. And that mechanism drives every single one of the problems I'm about to describe. The calcium does not just stay in the blood. It goes somewhere. And where it goes is what makes this dangerous. The first place it goes is the kidneys. The kidneys are responsible for filtering excess calcium from the blood and excreting it in urine. When blood calcium is chronically elevated, the kidneys are under continuous pressure to handle a load they were not designed to manage indefinitely. Calcium begins to crystallize within the kidney tissue itself. Kidney stones form. And beyond stones, chronic calcium overload causes a process called nephrocalcinosis, the progressive calcification of the kidney tissue itself. The kidneys begin to harden. Their filtration capacity drops, and kidney function declines in exactly the same silent pattern we see in other forms of chronic kidney disease. A study published in the New England Journal of Medicine found that high-dose vitamin D supplementation over an extended period was associated with a significantly higher incidence of hypercalciuria, excess calcium, in the urine and kidney stone formation in adults over 60 compared to those taking standard doses or no supplement. The study was large. The finding was consistent, and most of the patients involved had no idea their supplement was connected to their kidney problems. That sounds like a warning. It is not just a warning. That is the mechanism. That is what I see in the records of patients who come to me with kidney complications and a supplement list that nobody ever reviewed carefully. If you have ever had a kidney stone, even once, and you are taking high-dose vitamin D, please do not wait for the next one before having this conversation with your doctor. Request a 2,5-hydroxyvitamin D blood level test. Request a serum calcium level. Those two numbers together will tell you and your doctor whether your supplementation is helping or damaging. The second place that excess calcium goes is the arteries. And this is the one that concerns me most as a cardiac surgeon, because I have seen it on the operating table. I have opened chests and seen coronary arteries carrying calcium deposits. They should not have been there in patients who are otherwise doing everything right. Exercising, eating well, managing their blood pressure, taking their supplements faithfully every morning. Here is why most people never connect arterial calcification to a vitamin supplement. Calcification of the arteries is understood correctly as a consequence of aging, of high blood pressure, of elevated cholesterol, of chronic inflammation. Those are all genuine contributors. What is not commonly understood is that chronic hypercalcemia, elevated blood calcium from any cause, including excess vitamin D, independently accelerates that calcification process. Here's what is actually happening inside your body. When blood calcium levels are chronically elevated, calcium ions deposit in the walls of blood vessels, particularly in the inner lining of the arteries, called the intima. And in the medial layer of the arterial wall, these deposits harden the vessel walls. They reduce their elasticity. They narrow the channel through which blood must flow. And in the coronary arteries, the vessels that feed the heart muscle itself, that narrowing is directly associated with heart attack risk. The process is called vascular calcification. And a study published in JAMA Cardiology found that adults with chronically elevated vitamin D levels showed accelerated progression of coronary artery calcium scores, a direct measure of arterial calcification minus paired to those with normal vitamin D levels. The supplement that millions of people were taking to protect their bones was, in certain individuals, calcifying their arteries. That sounds alarming. It should be alarming. Not because vitamin D is inherently dangerous. It is not, but because vitamin D taken in high doses without blood level monitoring and without medical supervision is not the safe, harmless addition most people assume it is. The dose determines everything, and most people taking it have no idea what their actual blood level is. Do you know what your vitamin D blood level is right now? Not whether you are taking a supplement, your actual measured blood level. Think about that. Tell me in the comments how many of you have ever had your vitamin D level tested while taking a supplement. That answer matters because without that test, you are supplementing blind. The third consequence of excess vitamin D is one that most people have never heard discussed in connection with this vitamin at all: heart rhythm disturbance, cardiac arrhythmia. Here is why this connection is almost never made. When a patient presents with palpitations, with an irregular heartbeat, with episodes of racing heart or skipped beats, the conversation moves immediately to the heart itself, to electrolyte balance, to thyroid function, to caffeine and stress and sleep. Nobody asks what supplements they are taking. Nobody connects a daily vitamin to the heart's electrical system. And yet the connection is direct and physiologically straightforward. Here is what is actually happening inside your body. The heart's electrical system, the system that controls the rhythm of every heartbeat, is exquisitely sensitive to the concentration of calcium and other minerals in the blood. Calcium plays a direct role in the electrical depolarization of heart muscle cells. The action potential that triggers each heartbeat depends on calcium flowing in and out of cardiac cells in precise, tightly regulated amounts. When blood calcium is chronically elevated, as it is in hypervitaminosis D, that regulation becomes unreliable. The electrical threshold for cardiac cells changes. The rhythm becomes susceptible to disturbance. Palpitations develop. In susceptible individuals, more serious arrhythmias can be triggered. In patients who already have any degree of cardiac disease, the risk is meaningfully elevated. Research published in the European Heart Journal found that hypercalcemia from any cause, including supplementation, was independently associated with increased risk of atrial fibrillation in adults over 60. Atrial fibrillation, the most common cardiac arrhythmia in older adults and one of the leading causes of stroke, not caused by the heart itself in these cases, driven by a calcium imbalance caused by a supplement that was supposed to be helping. I've seen it more often than I'd like to count. And the tragedy of it is not dramatic. It is quiet. A patient who has been faithfully taking their supplement for years, who has never been tested, who begins to notice their heart feels slightly off, who is prescribed a medication for arrhythmia, and who never learns that the supplement they are still taking every morning is part of the picture. If you are taking high-dose vitamin D and you have experienced palpitations, irregular heartbeat, or episodes of racing heart, please do not manage that symptom in isolation. Ask your doctor to check your serum calcium and your vitamin D level as part of the investigation. These are not expensive tests. They are standard blood tests, and they may completely reframe what you and your doctor decide to do next. The next consequence is where things become far more serious and far more cumulative. The fourth thing that excess vitamin D does is something that builds so gradually that by the time it is undeniable, the person has been attributing it to everything except the correct cause for months. Nausea, loss of appetite, constipation, abdominal pain, and a generalized sense of feeling unwell that does not correspond to any identifiable illness. The collection of symptoms that most people file under stress or aging or a digestive issue, or perhaps a medication side effect from something else entirely. Here is why this gets missed so consistently. These symptoms are non-specific. They occur in dozens of conditions. They come and go. They are easy to explain and easy to dismiss. And when a patient lists their medications and supplements for a doctor in a 12-minute appointment, the supplement column gets reviewed quickly, and the word vitamin carries an invisible badge of safety that medication does not. But here is what is actually happening inside your body. Chronically elevated blood calcium hypercalcemia has direct effects on the gastrointestinal system. Calcium at elevated levels reduces the contractility of smooth muscle throughout the gut. Peristalsis, the wave-like muscle contractions that move food through the digestive system, slows down. Everything moves more slowly. Constipation develops. Food sits in the stomach longer than it should. Nausea follows. Appetite falls. The calcium also affects the kidney's ability to concentrate urine, causing increased urination and with it a chronic low-grade dehydration that amplifies every other symptom. At the same time, elevated blood calcium affects the central nervous system. Fatigue deepens. Concentration suffers. Mood flattens. A diffuse, hard-to-describe sense of feeling off that the patient and everyone around them gradually accepts as the new normal. This is not normal. It is a recognizable clinical pattern. It has a name, the classic presentation of hypercalcemia, and it is taught in medical school. But it is rarely connected to a supplement in clinical practice because the reflex towards supplements as a cause of serious symptoms is simply not well established in routine care. A review published in the journal Clinical Endocrinology found that supplement-induced hypercalcemia was significantly underdiagnosed in adults over 60, with the average time between symptom onset and correct identification of the supplement as the cause exceeding 14 months. 14 months of nausea, constipation, fatigue, and feeling unwell, while the cause sat in a bottle on the kitchen counter every morning. The fix for this, if you recognize these symptoms in yourself or someone you love, begins with a single blood test, a serum calcium level. It takes minutes. It costs very little, and it will either rule out hypercalcemia as a cause or identify it immediately. If your calcium is elevated and you are taking vitamin D, your doctor will very likely recommend reducing or stopping the supplement temporarily and retesting in 6 to 8 weeks. In most cases, the symptoms resolve as the blood calcium normalizes. The damage is not permanent if it is caught before the kidneys and arteries have been affected for too long. The fifth consequence is the one I wish more people were warned about years earlier, and it is perhaps the most counterintuitive of everything I have described today, because it relates to bones. Vitamin D is taken primarily because of bones. The understanding entirely correct is that vitamin D supports calcium absorption and therefore supports bone density and reduces the risk of fracture. That is true. That is good medicine. But here is where people are never told the full story. The relationship between vitamin D, calcium, and bone health is not linear. More vitamin D does not mean more bone protection indefinitely. It means more calcium absorption. And when blood calcium rises past a certain threshold, the body's response to that excess calcium includes depositing it in soft tissue, the arteries, the kidneys, the joints, rather than in bone. The calcium goes to the wrong places. Here is what is actually happening inside your body. Bone health is not simply about getting calcium into the body, it is about getting calcium into the bone matrix. Specifically, that process requires not just vitamin D, but also vitamin K2, a nutrient almost never mentioned alongside vitamin D in supplement marketing, and it requires that blood calcium levels remain within the range at which the regulatory hormones that direct calcium to bone can function properly. When blood calcium is chronically elevated, those regulatory hormones, particularly parathyroid hormone, are suppressed. The very system designed to direct calcium to bone stops working efficiently. And paradoxically, high-dose vitamin D supplementation without adequate vitamin K2 can result in a body with elevated circulating calcium and still declining bone quality. The calcium is there. It is going to the arteries and the kidneys, not to the bone. Research from a major controlled trial published in the New England Journal of Medicine found that high-dose vitamin D supplementation, specifically doses of 2000 IU or more daily without monitoring, was not associated with improved bone density outcomes compared to lower doses or placebo in adults over 60. It was associated with increased kidney stone risk. The supplement designed to protect bones was doing so less effectively than assumed and causing kidney damage as a secondary consequence. That changes everything about how we think about this supplement, and it changes what the conversation with your doctor should look like. Let me bring all of this together now, because I want you to leave with a clear understanding and a clear plan. Not panic. Not the reflexive decision to stop every supplement immediately without medical guidance. A plan. Vitamin D toxicity does not happen at low doses taken short-term to correct a genuine deficiency. It happens when high doses, typically 2000 IU or more daily, are taken indefinitely without monitoring blood levels. When the supplement industry and the wellness culture around it have convinced people that more is always better and that vitamins cannot hurt, when no one asks what the actual blood level is and no one adjusts the dose accordingly. Knowledge without action is just worry. And I'm not here to make you anxious. I'm here to give you a plan. I call this the supplement safety protocol. 5 steps, no prescription needed. Start this week. Step 1. Find out what is in everything you are taking. Pull out every supplement bottle in your home. Read the label. Look specifically for vitamin D. It appears in multivitamins, in calcium supplements, in immune support formulas, and as a standalone supplement. Many people are unknowingly taking vitamin D from multiple sources simultaneously. Add up the total daily dose across everything you take. Write that number down. Step 2. Request a 2,5-hydroxyvitamin D blood test at your next doctor's appointment. This is the standard test for measuring vitamin D status. The target range for most adults is between 30 and 50 nanograms per milliliter. Below 20 indicates genuine deficiency. Above 100 is considered potentially toxic. Many adults taking high-dose supplements are sitting in the 80 to 100 range or above with no awareness of it and no symptoms that have been connected to it yet. Know your number before continuing any supplementation. Step 3. Request a serum calcium level at the same appointment. This test directly measures what elevated vitamin D can cause. If your calcium is above the normal range, typically 10.5 milligrams per deciliter or higher, and you are taking vitamin D, that combination warrants immediate discussion with your doctor. Step 4. If you are currently taking more than 1000 IU of vitamin D daily without a recent blood level test confirming you need that dose, discuss reducing it with your doctor. The current consensus from the US Endocrine Society and similar, the bodies in the UK, recommends that most adults over 60 do not require more than 800 to 1000 IU daily unless blood testing confirms a deficiency requiring higher dose correction. Higher doses should be taken only under monitoring. Step 5. Ask your doctor whether vitamin K2 should be part of your regimen alongside vitamin D. Vitamin K2 plays a critical role in directing calcium to bone and away from soft tissue. The evidence on its combined use with vitamin D for both bone protection and arterial protection is growing. It is not a substitute for appropriate vitamin D dosing, but it is a piece of the picture that most supplement conversations currently leave out entirely. I want to come back to Patricia for a moment. After we identified the connection between her supplement and her elevated calcium, her doctor recommended stopping the high-dose vitamin D entirely for 8 weeks and retesting. Her calcium normalized. Her nausea resolved. Her constipation cleared. She was retested for her actual vitamin D level for the first time in 11 years of supplementation. And her level was at 94 nanograms per milliliter, nearly double the upper end of the optimal range. She had been over-supplementing for years, faithfully, diligently, without any idea. She restarted vitamin D at 800 IU daily, a fraction of what she had been taking, with a plan to retest in 6 months. Her kidney stone risk was formally assessed. Her coronary calcification is being monitored. It did not reverse. Some of that damage does not reverse, but it stopped being driven by a supplement she no longer needed at that dose. She came back to see me 4 months later. She sat down, looked at me, and said the words I have heard more times than I can count in 30 years of this work. She said, "I was doing everything I thought was right. Why didn't anyone check?" That question has stayed with me ever since. It is a big part of why I make these videos. Let me say each consequence one final time. Excess vitamin D raises blood calcium and elevated blood calcium deposits in the kidneys, forming stones and progressively reducing kidney function. It deposits in the arterial walls, hardening and narrowing the vessels that carry blood to the heart. It destabilizes the electrical environment of the heart, increasing the risk of arrhythmia and atrial fibrillation. It causes gastrointestinal disruption, fatigue, and a generalized sense of unwellness that gets explained away for months or years. And it paradoxically undermines bone health by redirecting calcium away from bone and into soft tissue when taken without vitamin K2 and without monitoring. None of this means stop taking vitamin D today without speaking to your doctor. It means stop taking any supplement blindly. It means get the test, know your level. Let the dose be determined by what your body actually needs, not by the label on a bottle or by a general recommendation that was never calibrated to your specific blood work. You now have information that most people taking this supplement every morning do not have. Use it. Which of these consequences surprised you most today? Was it the arterial calcification, the kidney connection, the cardiac rhythm risk? Tell me in the comments below. I read every single one. And if you know someone over 60 who's been taking high-dose vitamin D for years without ever having their blood level checked, share this video with them, not to frighten them, to give them what you now have. A reason to ask one specific question at one specific appointment. That question could genuinely change what happens next. And if you have not subscribed yet, please do. Every week, I bring you honest, evidence-based information that I wish every one of my patients had access to long before they needed surgery. Take care of your heart. It has been working for you every single minute of every single day without asking for anything in return. Give it what it needs. It is a fair trade. One last thing, and this is important. Everything I've shared today is general medical information based on published research and my clinical experience as a cardiac surgeon. It is not a substitute for your personal medical care. Please do not stop or reduce any supplement or medication without speaking to your own physician first. They know your history. I do not. This is education. Use it as the beginning of that conversation.